Again, as we take a look at who we support and who our patient populations are, I think this is a key opportunity of why we're at the table. When you take a look at the numbers of diabetics, hypertensive patients, depression, and taking a look at the population health, at least within the areas that we serve, you can see that there is existing a great opportunity to be able to leverage technology to be able to improve the outcomes of these patients. And when you take a look at really what high tech is trying to do from the standpoint of funding and giving physicians the ability to adopt technology, it really very much is to put in a foundation to capture data, to then use that data in a clinical setting and ultimately improving outcomes. And as represented by the slide, the numbers of patient visits, and what we're seeing with regard to the underlying medical conditions of these patients, that certainly is a very key opportunity. What we provide as services is everything from project management, from training, both online, CBT, and one-on-one kind of settings. We also provide grant and report writing capability, technical assistance across those facilities, workflow and process considerations, the ability to know how to take a system live. It's one thing to sit and plan and basically try to move towards adoption, but that very careful orchestration of the events that need to happen to go live so that there is not a disruption of patient care is a critical opportunity. We help our members with EHR development, again, the planning that goes into it. I think very much Paul highlighted that as a key opportunity. So we're there for the day-to-day application support, and we also provide the very important effort of business continuity planning and disaster recovery. When you think about it, it's one thing to apply technology, but it's another thing to be ready when that technology is either not functional. And in a state like Florida, where we are often challenged with storms and other natural disasters, this becomes even more critical, and having that availability of the information is as critical. Our core service offerings are practice management system, electronic health records, which also include e-prescribing, lab ordering, specialty provider referrals, the quality reporting, and most recently electronic oral health records, which is a key opportunity, as Paul shared, to integrate the full spectrum of care for patients being served by those facilities. One aspect of the service that we offer, which again maybe individually our members could not afford, is the ability to host all of this in a very secure, high availability data center. And so through our partnership with Quest, we're very fortunate to have them as that data center offering. And again, everything that affords us from the standpoint of the support, the availability, and the critical nature of that data and the high availability of it. The organizational structure of CHCA, we're very proud of the fact that we are 100% basically Section 330 health centers. Our board is entirely made up of those facilities, and pretty much they work collaboratively to be able to determine the direction, the focus, and the opportunities with which the health center network is participating and helping them with. So they meet every other week, and they meet annually to be able to determine the direction and goals and objectives of the organization. We're also very proud of the fact that back in 2004, long before this became basically the mainstay of what we're trying to do as a nation, we definitely saw the ability to get together the senior clinical leaders within those facilities to determine what things that they would really like to use and what needs to be there from the standpoint of the system functionality, reporting, the ability to use the data meaningfully. And so we've been at this for quite some time. And so with those centers and those meetings, we kind of focus on the things that the system needs to do, the functionality that needs to be there, the reporting that needs to happen in order to make the best use of that data. So again, it's not enough just to put the system in place, it's how we capture the data, it's how we use that data in the clinical setting to ultimately be able to help with improving the outcome. So this committee is a very important structure of CHCA and a very important involvement from the standpoint of our members and those that we serve. In 2007 and 2008, We were very honored to receive in both years a high-impact electronic health record grant from HRSA that allowed us to be able to do the planning and the implementation reach deeper into those health centers that we serve. In 2007, we undertook the Health Information Exchange Planning Project, again, the recipient of another HRSA grant. This is very important in the state of Florida that has many diverse and geographically located regional health information organizations. So this provided us with the seed funding to actually go into those communities and look at how they were being connected or not, and the opportunity to build on that and how we would implement our architecture. The one thing that I think that we clearly learned, and I think many, both here today and in the virtual audience, understand, is that once you've seen one Rio, you've seen one Rio. And so the opportunity of how you connect them is very critical. When you think about what we're trying to do with the high-tech provisions and the funding that we're giving to physicians, it's not merely to put in the technology. It's how we also not only capture the data and use the data, but most critically, how we share the data. That is a key opportunity as you take a look at us moving forward and what we are doing as a nation. And so again, this planning opportunity back in 2007 was a critical opportunity. In 2007, we also received an innovations project to implement an electronic oral health records system. Today, we have 2 centers that are live. We're working on 2 more. And again, this is a very critical aspect from the standpoint of the whole picture of continuity of care for patients being served within those facilities. So this is something that we will hope to build on, and a great opportunity for our federally qualified health centers. In 2009, we were also honored to host an electronic health records national workshop. 14 states and Puerto Rico attended that, and it was pretty much sold out. So the opportunity was to share with those states and basically those that were in the audience what we've done, how we've done it, and the opportunity for successfully implementing electronic health records. So that was a 2-day workshop that I think a lot of information came out of, and hopefully a lot of value for those organizations that attended. In 2010, we received another HRSA grant for health information technology implementation. And again, from the standpoint of the particulars of that, it really is to enhance what we were doing with the systems we already had in place, and most importantly, driving towards that definition of not only implementing the technology, but meaningfully using it. So how we implement HIPAA compliant secure messaging, the portal information that needs to be there to connect the physician to the patient is a critical opportunity with this. Part of what high tech envisions is that every American will ultimately have a personal health record. This is a critical opportunity for that information sharing, not only physician to physician, but most critically physician to patient. Being able to make certain that the electronic health record system is integrated with the practice management system is a key opportunity and capability. And of course, advanced electronic prescribing, which includes the ability to download that patient's medical history from the standpoint of their prescriptions, and being able to have that in front of the physician at the time that they're writing that script. As Paul shared earlier, the ability of the dentist to be able to write a script and have that physician know it and see it. The ability for our physicians to be able to know across the spectrum of care delivery who's writing what scripts and what those are for. This is also a great opportunity to make certain that patients are actually taking their medications, as a physician can look at that medication history and clearly see whether it was actually filled or not. And then finally, the documentation that needs to be put in place to be able to support not only integration of primary care, but the integration of things like behavioral health and other ancillary care that a patient should be getting. And finally, leading to quality reporting, which is really key in the use and the clinical setting and the adaptation of that information. And that leads me to my fun charge for today and for the next foreseeable future, and that's the Regional Extension Center. We are very honored that CHCA was awarded one of 4 in the state of Florida. And again, our name and what we position this as really is the advancement of health IT and the center around making that happen. So we are the Center for the Advancement of Health IT. and a great opportunity not only for what we're trying to do today with push adoption, but the long-term vision of how that technology is used, how the information is shared, and ultimately how that improves outcomes. We have a very diverse and a very wide geographic reach within the state of Florida. We cover 39 counties, over 30 of which are rural. So this is one of the other foundations with which I'm very proud that CHCA was selected, because we already have deep domain experience and a great opportunity already in place working with the rural communities. So taking a look at our opportunity specifically as an REC is to be able to outreach to 2,005 physicians and priority primary care providers, and getting them to either implement EHR or to improve their electronic health record foundation to the point that it reaches meaningful use. Again, we serve a very large population within that area of Florida, and as you're looking at the map, again, it covers from the entire panhandle all the way over to where I'm living, which is in Jacksonville, and then we also have counties just south of our headquarters in St. Pete, 5 locations. We couldn't have done this without the collaborators and those very communities that we support. So one of the things that we did in pulling this together was outreach to organizations that are already in the communities, serving those communities, and have a need to be able to make this a success. So you're seeing all the different organizations, from the regional health information organizations, the health departments, the rural health initiatives, even some universities such as Florida A&M, the health planning councils, all were a huge part of our opportunity, and today are part of the team that is going to help us deliver our services to such a remote, in some cases, and distant areas of Florida. We kind of call our approach to the community, communities in action, and that's really what we're about. So we want to enlist the services of those various stakeholders and others that you just saw to be able to do everything that we need to outreach, to communicate, to basically educate the physicians, to be able to do what we need to do as a team to help them with everything from vendor selection and the implementation services, project management support, the workflow redesign that has to occur. Again, we fully recognize, with all the years of experience we have at doing this, that upfront planning and that project management is absolutely critical to making this a success. So a huge opportunity as we move forward as a team is to convince physicians of that upfront time that's required to really sit down and assess the practice, engage in project planning, and then implement a system and a solution that will take them where they need to go at the end of the day, which is, again, is not only just implementing it for technology's sake, but meaningfully using it, and then being able to address the exchange that has to occur to share that information to improve outcomes. So with that, we have education and support for functional interoperability and health information exchange. And most importantly, as we're out doing this, it's one thing to make the system and the data more widely available, but we have to be cognizant of the privacy and security implications of that and the need to readdress that. Years ago, many organizations, such as those I was honored to lead, helped physicians focus on HIPAA, privacy, and security. Well, we have to revisit that anew, and with a greater emphasis on the more availability of that information, the possibility that that information could be misused. And finally, a big opportunity for all of us is local workforce support. We know that we have a precious and scarce resource of health information technology professionals to help physicians. So being able to work with our local community colleges, our areas of education to improve the workforce, get the kind of talent and capability we need to help physicians is absolutely one of the more critical aspects of this, and a great opportunity. Again, while we're focused as a mission on priority providers and those they serve, we also hope to serve specialists and other physicians within those communities as part of our program. When you think about it, the information exchange that needs to occur is not only a function of that primary care physician, but those specialists and others that they're having to outreach to, coordinate care, and communicate that information.